Now let's go talk about this nerve right here. All the way from C6 and to T1 root, so everything but C5. You have the median nerve. So median nerve, very important, and you definitely need this. I did talk about the innervation and how it affects like the flexion of 3.5 of your fingers. So what does it innervate? Well, your forearm flexors, so over here, your pronator teres and quadratus, your digital flexors. So this is why the median nerve is very important for grip and flexion. And let's talk about something called the carpal tunnel. So what we have here is the carpal tunnel, and hey, we have our buddy, the new friend, the median nerve, right? So it's running through along these tendons and through this transverse carpal ligament right here. So what you actually have here are your carpal bones. So this transverse carpal ligament, sometimes called the flexor retinaculum, so it actually forms this like tunnel. Here we have most of the tunnel, but this ligament kind of spans that tunnel. So we have our median nerve actually running through that tunnel right there. So this is a normal section, but what happens in this? Well, when we have something called carpal tunnel syndrome, some of you might be very familiar with this, is that this median nerve gets compressed. And the thing about nerves, remember when I talked about intervertebral discs and spinal nerves and bulging and hernia discs? Nerves do not like being compressed. They don't like room to breathe. And when you start to compress them, that's when they start to act funny. They may get sensations that aren't supposed to be there, or you may get loss of control of that nerve. So carpal tunnel syndrome, let's talk a lot more about that. So this is why you have it. So remember, pretty much everything but the C1, which is mostly motor, is a mixed nerve, meaning it's both sensory, it detects stuff, and motor. It carries out things, it flexes muscles, it carries out commands. So this is the sensory part. If you compress the median nerve, you're going to have funny sensations in the median nerve. So if you have carpal tunnel syndrome, or if you had it, if you had that kind of tingling or pain or some sort of weird sensations in your wrist and your forearm and your hands, well, that's due to your median nerve saying like, hey, I'm being compressed, I'm being squeezed here, and it's sending all these weird signals because of that compression. And loss of grip is common. So now we're not talking about sensation, we're talking about motor nerves and actually sending out motor signals through that neuromuscular junction, causing these skeletal muscles to actually contract, right? So this is what is happening. You have problems with sensation and problems with motor control. Again, this is why you have a loss of grip, because again, look at this. It's controlling most of the flexors here in your hand. So there are many possible causes of carpal tunnel syndrome, but what do they have in common? They all involve that median nerve. So that's why median nerve and knowing where it is very important for knowing understanding carpal tunnel syndrome. And this is what we have here. So notice what we have here. So this is kind of like showing from a ergonomic. So what we see here is that right here, this plane right here is trying to tell you like the alignment of the median nerve. So in the parts that it says it's right use of the mouse, notice that it's kind of keeping the median nerve straight and unkinked. Whereas in here in the wrong, what you have, well, if this is your median nerve, you're introducing a bend in that. So when you're bending your median nerve like that, you're kind of smashing it against either the ligament or the wall of your carpal tunnel, right? And same with here. If you flex or extend, well, you're bending your median nerve. So it's kind of like, or if you have a hose and you put a kink in the hose, do you still get natural, or do you get as much flow through that hose if you put a kink in it or bend in it? Not really, right? Same with the signals and action potentials you send along your nerves. If you start bending your nerves and forming kinks in them, well, that's going to affect their function as well, just like that garden hose. So again, here we have like lateral flexion, and yeah, so again, this is why they say when you type, you also shouldn't type like this or type like this. You want to keep your median nerve kind of straight, right? Okay, so how do you diagnose it? Well, the thing is that, I mean, typically, why do you go into the clinic saying, I might have carpal tunnel syndrome? Again, those numbness, the loss of grip, that weakness, that pain sensations. But what they might do at the doctor's office is electromyography. So it does have electrodes here, so it's sending a very mild current. It's not going to like send you a very big shock and you're like, and like it's not going to be painful. what they're doing is sending a current and kind of measuring how fast it takes to travel to these sensors right here. So in typical carpal tunnel syndrome, we see a delay in the signals. Don't worry about memorizing like exact values. And Tinel's sign, another way you can do that without the fancy electromyography equipment is just kind of tap it. Like a physician might tap your wrist right here where the carpal tunnel, so they're actually applying pressure. And remember, that median nerve doesn't like pressure. So if you have, if it's already like prone to, if you already have carpal tunnel syndrome and it's sensitive, well, when you add additional pressure, it's going to send signals. So some people, they say it's almost like, it feels like electricity or numbness or tingling when they have Tinel sign. And that's a positive Tinel sign when you have that pressure, you tap it, and then it sends a sensation all the way up their arm. Remember that median nerve is going all the way up to that C6 to T1. And carpal tunnel surgery. So how do you treat that? Well, typical carpal tunnel surgery, and if you're very sensitive, it's already in the slides, but if you're sensitive, you might want to look away. And here's what we have here. So carpal tunnel release. What they're doing is taking this ligament. So they're not going to cut your bones because, again, you need those bones. And it's going to be much harder. But it's a lot easier to actually cut this transverse carpal ligament. So it's kind of like undoing your belt. You have this ligament kind of like holding your nerve in place and kind of compressing it. But say you eat too much at Thanksgiving and you release your belt, then everything kind of just gets released. The pressure is relieved, right? So that's what you're doing with this endoscopic carpal tunnel release. You're cutting this ligament so you kind of have, so you're releasing the pressure on this median nerve. So also, I think in the Martini, they refer to it as the flexor retinaculum. Same thing. Actually, I like this transverse carpal ligament because remember, ligaments connect bone to bone. Transverse is horizontal and it's on your carpal bones. I actually prefer transverse carpal ligament to flexor retinaculum just because it tells you exactly what it is. So yeah, that's what they're doing here. So they're doing the surgery, and they used to do surgery where they cut all the way, or yeah, they have some laparoscopic as well. But I think now they make a modified where it's not as extensive as it used to be. But still, you're cutting your carpal ligament. This is why you'll be out. If you do manual labor, well, you just kind of cut a major ligament in your hand. That's why you're going to be out for a few weeks. But this does heal. And do your PT, do your occupational therapy so that it heals well and you can get the tone back in your hand. So